Hi, good morning, everyone. Welcome to our first InnoHSupport webinar. So thank you very much for joining us today. We are now waiting for the attendees to join, so they are still joining us. So we have almost 50 registered attendees today. So we are looking forward to explain you this open call that we have recently launched within the project, the InnoHSupport project, to offer you some advisory services as healthcare provider. So let's wait 1 minute more so people is still joining. Okay, so I think we can start now. So my name is Maria Bernabé. I am a project manager at TIC Biomed, and we are InnoHSupport partners. So today, this is our agenda for this webinar. So we have now people still joining us, and then we will move to the first part of the session. So Laura Sanchez from Silo, so the project coordinator, will provide us an introduction of the project. So she will explain the project in a nutshell. And then we will move to the advisory services itself. So I will be introducing you this part of the session, and then we will go to the main part of the webinar. So we will explain you the 3 advisory services that will be provided in this for this open call. Then we will have some time dedicated to the Q&A session. So we will receive your question and thoughts during the webinar, and they will be addressed at the end of the presentation. So this is our team today. So thank you very much for being here and for being part of this session. So we have, as I mentioned before, Laura Sanchez as a project coordinator from Silo. From TIC Biomed will be Ulises Pisano and myself on behalf of TIC Biomed. And we'll also count on Ana Miquel from Servicio Madrileño de Salud. So let's move to this part of this session. So I just want to give you some housekeeping rules. So the session is now it's being recorded, and we will publish the recording in our InnoHSupport channel. So you will receive an email, a follow-up email with the link to watch a webinar replay. So it will be publicly available for you. Now your microphones are muted, as you can see, so to avoid background noises. And during the entire webinar, you can send us your question and thoughts through the Zoom chat box. So you can find it in the bottom of the screen. So feel free to type the question you may have, and we will address them during the Q&A session. So if you want to you want to share your thoughts out loud, you can also raise your hand, and we will open your microphone at the end of the presentation. So now I want to give the floor to Laura Sanchez from Silo as project coordinator. So the floor is yours, Laura.
Thank you. Thank you very much, Maria, for the introduction, and good morning to everyone. And thank you for participating in this webinar, the first that we organize within this project. So my name is Laura Sanchez. I am part of the coordination team, and I'm senior manager at Silo, which is the coordinating entity. Moving into the project details, this is, and if you can move to the next slide, Maria, please. Thank you. So this is a European funded project. We are a consortium of 7 partners and 2 affiliated entities coming from 6 different European countries: the Netherlands, Spain, Ireland, Bulgaria, Belgium, and the UK. And we are formed by consultancy firms, university, public buyer, and different organizations which count with a high expertise in the field of public procurement of innovation, particularly in healthcare sector. Our project aims to enhance the uptake of innovation in healthcare through the strategic use of public procurement of innovation. And we tackle this problem because we have identified that it has been widely documented that one of the main reasons that hampers the use and uptake of innovation procurement is precisely the lack of capabilities in healthcare professionals and organizations. And this is a problem that InnoHSupp wants to cover and meet the gap. Therefore, our main goal is to provide a healthcare ecosystem with the capabilities that are needed to use innovation procurement. And this is achieved by a series of services that we offer. Our services include an executive training program for public procurement professionals, which is delivered under the form of trainers modality. That means one representative per organization will be the person that is trained, and it is supposed to spread the word and the materials inside the organization. There will be coaching and advisory services for public procurement organizations depending on the maturity level towards innovation procurement. And this is the focus of this webinar, the advisory services that we are going to offer under this service. And there is another service that we offer for providers, the matchmaking services for suppliers and investors. Moving to the next slide, which is also key because it informs about the upcoming important dates that we will have within each of the services. For the first service, capacity building oriented to public procurement professionals, the
Laura, sorry, you are on mute.
Sorry, can you hear me now? Yeah, so for the first service, the executive training program, the capacity building services, we intend to announce the call in the upcoming months. So please stay tuned to our LinkedIn account. The services will start after the summer, most likely. It's not 100% confirmed, but we just wanted to give you an idea on when these services are going to start. The advisory services, as I said before, are the focus of this webinar. The call has opened in December and it will remain open until the 28th of February. And this will be for the first tranche. For the second tranche, which will be for organizations that have a higher maturity level and wish to receive services in the field of funding opportunities, contract management, and tender preparation, the tranche will be open on April this year. And for the matchmaking services, the call will open on February and the session will be defined very soon. So with this very short overview, I would like you to focus on the advisory services and tranche 1, and Maria and colleagues will give you a deep overview of the content and the expectations for this service. Thank you very much, Maria, and the floor is yours.
Thank you very much, Laura, for the InnoHSupport project introduction. So let's move to the main topic of the webinar, that is the advisory services that will be provided for the healthcare organization. So first of all, I wanted to inform you on the 2 types of webinar that we will be organizing in these next 2 months in February, in this month, in January, sorry. So we have today, we are trying to explain you the advisory services themselves. So webinar, we will be focused on the introduction of the content of the 3 advisory services that will be provided within the advisory services and the methodology itself. So today, this is our main focus, so you can get all the details and information on the 3 services delivered. And then on the 28th of January, we will organize an additional webinar, mainly focused on the application and submission process. So in this webinar, we will dive into the administrative steps. So we will explain you what's the requirement you have to accomplish to apply to this call, and how the selection process will be, and so on. So this will be most related to the administrative phase of the project. So how you can apply and who can apply to this open call. So in terms of the open call, it was launched on December 2024, and it will run until the end of February, as Laura just mentioned. So the call will close on the 28th of February. So you have still 1 month and a half to understand what we are looking for and to apply to this open call. So the target audience that we are seeking is our healthcare organization. So we are looking for teams of teams of healthcare organization, more than 3 people per team from the same organization. So, and also we are looking for people that are not so experienced on the innovation procurement process, because the services that will be provided will be mainly focused on the first and the initial step of the innovation procurement process. So this is why now we are starting from the very beginning, so you can understand how to start an innovation procurement project itself. So then, as Laura also mentioned, this is the first tranche. So we have launched a first open call on December, and then we will launch a second open call in April. So it will last from April until June 2025. So this second call will cover a step for more mature organizations. So in this second call, we will provide services for more experienced innovation procurers. So you can see in the slide the call landing page that we have prepared for this call. So then when you receive the email with the information from this webinar, you will be able to access this presentation, and you will be able to access this link. So anyhow, I will send to you after my presentation through the chat. So here you can see the 3 advisory services that will be provided for selected healthcare providers. So the first one is related to the strategy planning. The second one regarding the needs identification, how to identify unmet needs within your organization. And the number 3 is related to the open market consultation. So how to launch, how to prepare and launch an open market consultation, and how to engage the market or interact with the market. So my colleagues will dive into these 3 services later. When it comes to the methodology, these advisory services will be divided into 8 steps. They will last 26 weeks. So the advisory services will be provided within a program of 26 weeks, following the different steps that you can see in the slide. So the session will be a group session, an individual session. So it depends of the topic that we will address during each of them. So they will be combined, individual and group session. And more or less, so you will be invited to 16 sessions. Each team of healthcare providers will have to attend this number of sessions. So then you will have, after the session, so you will be required to attend the session, but also you will have to dedicate time enough after the session to work on the real case based on your needs. So as you can see, we have the different steps. So the first one is the advisor appointment. So you will be appointed with an expert. So you can have the access to the expert during the entire 26 weeks program. So then we will have a group session. So the onboarding, we will onboard you and explain you how the service will be provided. Then you will have an individual session related to the maturity assessment, and we will assess the maturity of your organization regarding the service you have been selected, so the service that you will receive. Then we will have another group session, so we will try to explain the methodology in a nutshell to the different groups of participants from the different services. So we will have 3 different sessions based on the different services. And then we will have the planning and execution phases, so they will be individual sessions, and we will help you on the development of this work based on your case. Then we have a final group session to share knowledge and find synergy and collaboration between among the different groups of participants. And the final individual session will be with each of the teams to report and evaluate your work and the next step. So this is for the methodology. And now it's that's all from my side. So now let's move to the services that will be delivered in this open call. So now I want to give the floor to my colleague Ana from SERMAS, Servicio Madrileño de Salud. So now, Ana, you can start explaining the first service that will be provided regarding the strategy plan.
Thank you, Maria. Thank you to all the assistants for the interest in this webinar and the services that we are offering on our project. I'm Ana Miquel. I'm a family physician, expert in health management and quality management and innovation. And I would like to introduce this first service that we are offering. Probably is the service that all the organizations that are interested in public procurement of innovation have to do, and it is linked and connected with the second service of identification of needs. What we are going to offer you, we are going to offer the services to more or less 8 participants that will be selected for this service. And we are not going to make an exercise of strategic planning, but we want you to learn how to improve value delivered for patients and end users, addressing innovation challenges. So we are trying to connect the strategy with the innovation and in concrete with public procurement of innovation. And the different steps that we are going to follow in this strategy planning are this one. We are going to try to review with you to transform organizational needs into strategic goals. We are going to try to align priority needs with public procurement of innovation. We are also trying to for you to acquire knowledge of legal and regulatory frameworks, and finally, at last but not at least, we are going to try to develop an organizational strategy planning for innovation. So we are going to try to explain a little bit more, next slide please, about we are going to try to offer you. First step, to transform organizational needs into a strategic goal. Next slide. Well, we will try to, when we talk about the strategy, we are talking about envisioning what we want to achieve. Where do we want our organization to take? And the first step is have a clear vision of what is your strategy. The second step is enabling, establishing all the elements to make this vision real. And the third step is enacting, so to involve all your organization. We will try to review your strategy with you. We will consider a strategy, not only an strategic plan. We will consider all your project plans, organization goals, priorities in general, to at the end to have a clear knowledge of your vision. Some cases we are not going to have a lot of references, but we have value-based international reference that we will also try to review with you. At the end, we will have a clear vision of what are your main goals, your strategic main goals. Next slide. Second step will be align priority needs with public procurement of innovation. Next slide. Of course, when we would talk about aligning priority needs with public procurement of innovation, once that we have a very clear vision of your strategy, of your vision, then we try to prioritize what are your main strategic goals. Second, we will try to identify those goals that can be enabled by innovation. So we are in the step of enabling this strategic vision. And then we will try to review if these goals, if these elements has real and innovation window, and we will consider if public procurement of innovation is useful to introduce this kind of innovation on organizations, because our experience, our vision is that public procurement of innovation is the way in which we can introduce innovation in health organizations using our usual methodologies of procurement, and some new that are not very different and not very difficult. So we will also review the different types of public procurement of innovation to adjust what kind of public procurement of innovation is more useful for your needs. So prioritize, enable by innovation, and is it really innovation? Can we use public procurement of innovation, and what kind of public procurement of innovation? Next slide. Here we have an example of how we can measure if there is an innovation window, because one of the things that we will review it many times, we want to improve our organizations, and we think innovation is the key element to try to improve, but sometimes it is not innovation. To say that it is innovation, it has to be something new, something that has not been done till now. It can be a prototype, it can be something more next to the commercial application, but in all the cases, it's something that has not been implemented or not completely implemented till that moment. Next slide. We will review the different kinds of innovation. Here you have the definitions, but a summary, pre-commercial procurement is a research and development exercise in which very competitive with different companies till the end of the process, and it finishes when you get to a prototype or a short test of concept. Public procurement of innovation technologies is another kind, more next to the commercialization, and it is when you introduce a new technology or a technology that has not been completely developed in a new process. So you are, it is more near to the usual things that we used to try to introduce in our health services. And innovation partnerships is at the same time the pre-commercial procurement and the public procurement of innovation technology from the beginning to the end. Next slide. Our next step, we will try to review the legal and regulatory frameworks. And next slide. One of the things that we will insist is that we are not going to use new public procurement procedures. They are approaches to using existing tendering mechanisms in such a way that the outcome of innovation and the growth opportunity for suppliers are optimized. But we will review at the same time what is the usual process of the binding process and the public procurement of innovation process, insisting on the different regulatory frameworks that we are going to use. Next slide. And in some cases, we will review aspects like, for example, the specific requirements for EU pre-commercial procurement of innovation, the rules of participation, or the specific requirements in the case of public procurement of innovation, and other common aspects that are very relevant for public procurement of innovation, like transparency, publicity, or anti-fraud fights. So we will review the usual procedures, and we will insist probably in some specific requirements and some relevant aspects. Next slide. And the last step will be to develop an organizational strategic planning for innovation. Next slide. One of the main things that in which our organization fails is that we think about what to do, but we don't use to implement it, to develop it successfully. And we will insist that there are what is called implementation science, very useful also for innovation, that says that when you use programs that incorporate standardized complex components, such as effective program, practical longitudinal measures, through partnership approaches, the results are better than if you use just only some communication activity or so. So we are going to try to focus on implementation also. Next slide. We will use some reference model like the evidence integrated team goal that recommends, for example, co-creation, dissemination, training, and monitoring of implementing indicators. Next slide. Next slide, please. And we will also make some comments about what is change management, what we have to count in the change management, including cultural change, like elements like to have a clear vision, to share it, to be consistent, to share why and what for, the different steps to develop, to facilitate consensus and participation, to share and evaluate outcomes, and the different elements of change management that will help us to implement our strategy and to link it with this strategy innovation plan. So this is what I wanted to share with you. We will help you to have this clear vision of what is your strategy, how to link it with public procurement of innovation, what your legal framework, and also how to implement this public procurement of innovation plan. Thank you very much. And now my colleagues are going to go on.
Thank you, Anna. Thank you very much for such an insightful presentation regarding this first service, strategy planning advisory service. So if you have, so I think that it's super clear, but if you have any question, any doubt, so please use the Q&A chat box that you can find in the bottom of the screen. So we will address your question at the end of the presentation. So feel free to type and send them to us. So now let's move to the second service. So regarding the unmet needs identification. So Ulises Pisano, you can start diving into the topic.
Okay, thank you. And thank you everyone for joining. I'm going to explain the next two services, the Service 2 Needs Identification and the Service 3 Open Market Consultation. Something important about these two services is that they are, I mean, the three services are really related, but these two are quite much related at the point that if you have not done this part, the identification in your organization, you cannot apply to the third service. So if you are wondering which one you should be applying for, the answer is quite clear. If you have done the needs identification within your organization, you can apply to the open market consultation, but if not, this is your service. The goal of this needs identification is basically to create, to systematically create an understanding within your organization so you can start uncovering and identifying needs, transforming them into challenges, and operationalizing them. We're going to choose up to 6 participants for this service. And as I was mentioning, the basic idea is to help the teams participating in this service to know what are the weaknesses and strengths of the organization, what are the different things that they should be paying attention to identify these needs, to transform them into challenges, and to operationalize into KPIs and into something tangible. So when it comes to time to go to the market and find a solution for your need, you already know what you specifically need to solve the problem. What is the need for you in this service? 3 different things and very basic. The first one is to learn to recognize and meet needs. What is not working properly in your organization? This may sound basic, but as we will see later on, is kind of complex. And then how to transform these needs, these intangible needs, into improvement opportunities, how to create some KPIs, how to create ways to measure what are those needs and how to improve them, and transform them into something that a company can transform into a solution for your organization. Then you will learn also how to prioritize these needs. As you know, in healthcare organization especially, but in almost any organization, you may have a lot of needs, but then you need to narrow the process until a very few, because you cannot focus and address all of them. So you will learn also how to do this in different terms, not only paying attention to the cost benefit, but also other things that will help you. And also to become familiar with methodologies to evaluate the performance and create solid KPIs for your organization. Next slide, please. So the basic goal of this service is to help organizations to identify organizational and patient-centered needs that will be used as foundations for the innovation process, in this case, for the public procurement of innovation. The main challenge when we talk about these things is how to align the different points of view and perspectives of an organization, of the different stakeholders of organization, so we can be sure that the voices of all the participants in our organization, medical staff, IT, any other units are taken into account to create those challenges and to leverage this knowledge, let's say, for innovation. When it comes to implementation, what you will learn how to do is how to use already structured frameworks for decision making, to collect data, to facilitate the discussion between the different units in your organization and the different teams, and to create a solid evidence-based knowledge of what is needed into your organization. The objective, or the final goal, let's say, is to be able to focus efforts and resources on addressing the most critical needs of your organization. Okay, thank you. So how are we going to do this? Is quite basic. The first step is to identify the stakeholders that are relevant for the need identification, which among the different people that are working into your organization are relevant to define what are the different things that you should be working on to improve different aspects. Then you will not need also to define clearly the roles and expectations of what you can achieve through this process. In the second step, what we're going to do is through the conduction of workshops, surveys, and different methodological tools, to collect information, to collect data, so we can create solid evidence about what needs to be improved and how to do it. And in the last part of the process, we will learn, as we were mentioning, how to prioritize these needs. This is quite critical because this is not only about deciding what is the most economically aspect that we should be improving, but also in terms of what could be easily done or how to create consensus among the different participants. So when it comes to time to adapt or to implement the solution, we already have the engagement of the participants, which could be patients, medical staff, and so on. For doing this, we will use different matrix tools and also some workshops to build this consensus among the organization. So we can also ensure that we are all of us on the same page when it comes to the innovation. Next slide, please. So then the question is, what is the benefit of doing a need identification within your organization? Basically, there are three fields that will be affected and will be benefited. The first one is the strategic field. Through this process, your organization will improve the understanding of whether your needs, your weaknesses, your strengths, but also what you are good at what you are not so good that should be improved. What are the things that your medical staff require? What could be really improved? What are the things that could be addressed with little? What needs more effort, and so on. Then you will also learn how to, as I was mentioning, how to transform this into operational necessities. So when it comes to time to ask a supplier for providing a solution, you will be ready to check with the market and to understand about the most state-of-the-art innovations. And it will be easier for the suppliers to provide a solution that you have already identified, in terms that, for example, you can then provide specific requirements. So you know what you are looking for, then the company can provide something more tailored to your necessities. This will ease also the deployment and adoption of the solutions, and will in the end avoid misaligned procurement strategies, because once you know what you need to do, it will avoid problems with definitions or with different departments within your organization. In the operational field, this will help to ensure that the allocation of resources is efficient as maximum as possible. It will also help to facilitate the consensus among the different stakeholders that are part of your organization, and will in the end improve the provision of services. The main outcomes that you will get from this needs identification will be the improvement of the outcomes in terms of health for the patients, in terms of quality of work for the medical staff, and the environment surrounding them. And also, you will boost the value that you can provide as an organization, not only in terms of, as we were mentioning on the cost-benefit analysis, but also in terms of the value you are providing. And finally, this will help you to adapt the organizations to the most up-to-date standards. Next slide, please. Now I'm going to jump into the open market consultation. As I was mentioning, the open market consultation will be the process in which, once you have identified your needs, you check against the market, what can you do with these needs? For this service, we require that the participants or the applicants to be participants have already done a needs identification process. So you will need to have all these needs already identified to participate in this service. We will choose up to 4 participants for this service. And the idea is to help participants to engage with market, which are market players, companies, startups, other providers, and even other healthcare organizations, in order to validate their hypotheses when it comes to the identified needs, and also to refine their necessities and understand what is possible to do, what is not possible to do, how they can improve the provision of services, if there is something already on the market that could help them, if this is not viable, if this could be done through innovation, if there are other solutions, and so on. So basically, the idea is that you will learn how to conduct some tool and tasks to do this process. Among these tasks, you can find workshops, surveys, and market research, but you will find others as well. What is in it for you? As I was mentioning, the use of different approaches to validate needs against the market, to be able to identify different market opportunities and barriers, and to become familiar with the most relevant players in the field. And also, conduct market consultations so you can fine-tune your organizational needs and address them. Next slide. When we talk about the goal of this open market consultation, the main goal is to bridge the gap between the organizational needs and the market capabilities. The main challenge is to get the proper scope for what you are looking for. Sometimes the companies need to solve the things, but they don't know clearly what they have to do or what they are really needing to do. So in this sense, we will help the participants to clearly define the scope for what the suppliers need to know in terms of the necessity of the organization, and then validate this necessity with market players and external stakeholders. For implementing this service, we will help the organization to conduct an open market consultation, but this will be up to the organization participating, of course. and also to encourage open dialogue with suppliers through market surveys, workshops, question and answer sessions, and so on. The final goal of this process is to find an innovative solution for the need or needs that have been previously identified by the organization. Next slide. When we break this down into different steps, we can find these three. The first one is to prepare the consultation with the market. So what you need to do in this step is to have a clear idea of what you are looking for, what we have called definition of the scope, and then also the field of the solution. How are you going to approach the solving of this solution? Are you thinking about just getting something technological? Are you thinking about combining different solutions that are already at the place? Are you thinking on putting together different units and helping to work on the same problem? So you need to have a clear idea of what is the problem, who should be involved, and how they are going to be involved in the process. Then you will learn how to identify the relevant market players that will help you in the provision of a solution for this problem. And then the development of consultation materials. Depending on what you are looking for, you will need to create some surveys or to conduct some workshops. It depends on the case. Then in the second step, you will execute this process, either creating an open market consultation or directly creating workshops or just with market service. This will be, as we were mentioning, totally up to you. And finally, you will need to analyze this information to know what is relevant, how can you fine-tune the solution or the expected solution you were envisioning, how to give it a thought again and rethink what you are needing for your organization, and so on. And next slide. And the final benefits of this process for the strategic point of view will be the reduction of risk of failed procurement and acquisition of innovation, because once you have gone through this process of involving different stakeholders and helping them to co-create the final solution you are expecting to adopt, it's quite unlikely that this will fail, because you will have something that is totally tailored to the needs that you had already discussed within your organization, with your medical staff, with your IT department, with your legal department, and so on. In this sense, this process encourages also the innovation within your organization, because you are not only trying to find an early supplier, but you are also boosting the co-creation between your organization and the market. And also will help your organization to cope with day-to-day problems through the provision of tools and other means to do so. In the operational domain, you will have your organization goals by paving the way for suppliers, which means that they will have for them will be easier to know what you are looking for. Then you will also help increasing the collaboration between your units and external entities. And by doing so, you will save time and resources by aligning early on. The final outcomes of this process are quite clear. The first one is that you are going to get a solution for something that you have identified. So you will get an innovative solution. You will tailor solutions to internally consensual needs, and you will benefit from the advantages of closely working with innovative suppliers, which in the end will improve the efficiency and the resources allocation of your organization. And I think that's all for this part.
Yeah, that's all from the Open Market Consultation Service, indeed. So really appreciate it, Ulises. So I assume that the information and details regarding this service has been successfully provided by my colleague Ulises. But yeah, nevertheless, so if you have any doubt or question, or you want to share anything, please feel free to use the Q&A box. So we have not received any question through this Q&A box so far, but you are super invited to do so. So we are here to solve your question, and we are so we have finalized the presentation on time. So we have now this 15 minutes dedicated to the Q&A session. So we can address the question you may have and solve the doubts regarding the services. So this will be the 3 services, so you can apply. So you can, I want to share with you and to inform you that you will be allowed to apply to the 3 services, but only one will be awarded. So we can receive proposal if you are interested in more than one service. But then when we start the assessment and evaluation of proposal, we will select only one per organization. So you are, you will be able to receive only one of these 3 services. So anybody wants to ask any question on everything is super crystal clear. So I don't know, Anna or maybe Ulises, if you want to share anything else or to point out any aspect.
Just to comment something else. In the meanwhile, if no one is asking any question, we're gonna upload this video also to the website, right? And we will also gonna share it. So if you have any doubts or if you watch it again or whatever, and you think that there is something that is not clear, you can always send us a mail. We will open up a specific mailing address for these questions, right?
That's it. So I will, you will have access to the presentation, to both the presentation and webinar recording on our call for advisory services website that I have shared through the chat. So I sent to all of you. You can now access to this landing page that we have assembled for this call. And then you will also receive a follow-up email. So I will send you from Zoom a follow-up email with the link to the presentation and webinar recording, to the contact email address that you can send. So through you can send us your question or doubts or any concern you may have. So it is available for you. We have created this email account to receive any question. And also, you will have all the information regarding the call, but we will organize this next webinar, as I mentioned before. So we have received a question from Ines. Can be requested an interview to have an orientation? So I think that this is regarding the methodology. So the first session will be an individual one to appoint you an advisor expert. So this could be the first initial session that we can have with you to start discussing on what you need, or based on your need, what you have to do. So Ulises, do you want to?
Because I'm not sure if what she's asking is if there can be an orientation interview once the advisory service starts or before applying. Yes, I think that's what. I don't know if you can
please, Ines, to specify a little bit more?
I think you have to give her the floor, but I'm gonna try to do it here.
Yeah, perhaps I can open the microphone.
Yeah.
Okay, so let me open. Yeah, Ines, now you can go ahead. Ines, can you hear me?
Well, in any case, if before, okay. So yes, you can send us a mail and we can try to schedule a video call so we can have this session. Yeah.
Yeah, okay. Perhaps.
Maria Ulises, I would like to make a comment because many of the participants in this webinar and in the call are healthcare providers, and they are procurers from healthcare organizations. I belong to one big health care organization, and I would like really to invite the organizations to participate, because from our experience in public procurement of innovation, we really believe that public procurement of innovation is a good tool to introduce innovation in our organizations and to try to promote this transformation of our health organizations. And it is not as difficult as we can think before working in public procurement of innovation. The reason why we are participating here is because we really believe that this is a very useful opportunity for healthcare providers. And also the second comment is that we have fragmented the services in different services, but of course we are going to adapt the services to the needs of the different organizations. And when we will talk about open market consultation, probably we start with the identification of if you have a clear need, for example. And when we are going to talk about needs identification, we will have a look at what is the strategy. So uh, I think this is a very good opportunity of trying to introduce our organizations in not only in public procurement of innovation, also an innovation. And I really believe that now innovation is coming to help us in transforming our organizations. So and if you consider you know any healthcare organization that could be interested, invite them, because they are going to have opportunities even without participating in this webinar. So I just wanted to yes, to try to translate this vision of this can be very useful and very interesting for the healthcare organization at this moment, especially at this moment when we have a lot of problems, we have a lot of needs, and the innovation can help us to resolve these needs and to improve, make a big step in improving our healthcare organizations.
Yeah, that's it. Thank you, Anna, for your contribution. So, yeah, now if anybody has any other question. No, so in the meantime, let me share with you the details for the next webinar, the next informative webinar that will be held on the 28th of January from half past 1 to half past 2 set. So we have, as I mentioned at the very beginning, this webinar will be mainly focused on the application of submission process and the requirements you have to accomplish to apply to this call. So now you can start signing up. So let me share with you the link. So you have now in the chat the link to register to this webinar, and you will receive this presentation as well. So the link is embedded here, so you can access as well. And I will also include in the follow-up email the link to the registration form. So you will receive all the information you need regarding the InnoHSupport open call. So any other comment and question? Ulises, do you want to point out anything else? And I have provided you the contact email, so the email address in which you can contact us. So feel free to reach out us through this email. And if nobody has any other question or concern, I think that we can close the meeting, the webinar here, so 5 minutes before. Yeah, we are looking forward to receive your question and to solve them. So thank you very much for joining us today, and we hope to see you in the next webinar on the 28th of January. So if you are interested in one of these services, you will receive further details on the application process in this webinar that will be held into 2 weeks. So thank you very much, everybody. So have a nice day. Bye. Thank you, Anna.
Bye.
Thank you, Luis.
Bye-bye.
Bye-bye.